Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
A baseball injury, like throwing injury
Okay.
on my shoulder, probably from overuse. I got this was back in beginning of January, beginning of
This
the
year, so we are in September, not September, July.
Yes, yeah.
July, so 7 months.
Yeah, and then I had MRI. Everything they said the labrum was fine, rotator cuff is fine, but that I have bursitis, and I've just been having like clicking and catching and even grinding all over the shoulder, and it just hasn't gone away.
Okay, so for the last 7 months for your shoulder, so what kind of treatment did you have?
Massage. Yeah, a lot of massage there.
Did you see any physical therapist to work on that?
So far, no, I haven't.
So what's difficult for you to do because of this issue?
Well, throwing actually, because when I throw now, it feels just like the velocity is drastically slower, and it just feels difficult to drive it down. I feel significantly weaker in an overhead position.
Overhead position. So how much pain do you feel at worst from 0 to 10 in this emergency room?
Probably
at worst.
6.
6. Okay, so if we want to aggravate your symptoms now, what we can do?
I can do literally just throwing.
Throwing. What about, let's try to do like bring your arm up, like.
Oh yeah, probably bringing it up is pretty uncomfortable.
How much from 0 to 10?
Like 5.
5. So the thumb up here and bring it up this way. How much from 0 to 10?
That's just like a sharp little sting.
Yeah, I can see it like it's a little bit shaky there at the end.
It is, yeah. It's probably like a 6 or 7.
6, 7. Yeah. Thumb up and bring it up this way. And then toward your ear. How much?
That was like probably a 6 also. Yeah.
6. You limited a little bit. Okay. Can you do this? So I will assume no pain as long as you're not saying anything. Okay.
Okay.
Bring it back like this. So flexion and abduction, that's what aggravated.
Yeah.
And throwing.
Yeah.
So that was 6, 7, flexion and abduction. Okay. So this is the 3rd time. This is the 4th time. How much is now?
It's like a 7, 8. Yeah.
It's in the front.
Yeah,
right?
more so in the front.
More in the front. Do you feel it deep inside?
I feel like on the surface, yeah, and deep inside too.
Okay. So why scar tissue could be an issue? Because our muscle should act like a rubber band when we contract and relax and stretch like this. When we have a scar tissue, it's like we have a knot in a rubber band. So when the muscle contract, does not go much, and that decreases the range of motion in the elbow, the shoulder, and that could explain why you have that clicking and tightness in your shoulder. And you feel it at the end range of motion because your muscle cannot stretch further to the end range of motion. That's why you're missing 10 degrees flexion and 30 degrees abduction. So we can see the map of your scar tissue where there's redness. And with this treatment with ASTR tools, you should, after treatment, when you come back, you will notice that the thickness, the width of the scar tissue start to shrink. So it's basically, I'm shaving it with those tools. How's that?
Nothing.
Abduction? How's that?
Maybe less than a 1.
This is the one. So before we start, his flexion was 170 degrees. Normal is 180. Okay. And so let's try to see how is your flexion. All the way back. So that was 170 degrees. Can you see this? 180 degrees. Abduction was 150. So let's bring it back. Can you see this? 180 underneath my fingers. You see that? The correct answer is yes.
Yes.
All right. Sit up for me. Any pain or it's okay? Tightness
Almost
is okay.
no pain, and I feel like I just feel my arm velocity literally coming back.
Coming back?
Yeah.
Beautiful.
Little bit in the front, but
How much from 0 to 10?
like 1, 2.
Okay, let's do a couple of them. But let me know if the pain increases, okay?
Okay.
I want you to suck your stomach while you're doing that.
Okay.
We're gonna work on your body mechanics after the video. Okay? Did you feel it or how is it now?
It's not increasing.
You did 4 now.
Yeah.
How much is now from 0 to 10?
1 or 2. Yeah.
Okay, so you have a minor inflammation. I'm gonna use a Magna Heal to decrease the inflammation, and we'll have you try it again. As long as you don't feel pain, we're gonna do. Your max was like 4 when we did before,
Right.
but we're gonna do more now. As long as you don't feel pain, just keep going, but count, okay?
And the elbow feels better too, by the way. Just
The elbow, so what was the symptoms before when you did it now? Because you did not mention a lot. On
Yeah, I did.
the elbow. So what's going on before we do work on the elbow?
yeah, I felt just like a little bit of throbbing in there.
Oh,
and,
when
yeah,
you were
and
doing
dullness.
throwing? Okay.
Yeah, yeah.
hmm
And that was like a 4. something like
Okay.
that, and that's gone down.
That's
even-
before with the treatment.
Yeah.
Okay,
Yeah.
and now is
Probably 1.
okay. So let's do 5 or so or more. As long as you don't feel pain, just keep going.
Okay.
Okay. Any pain, discomfort?
Almost nothing, but like just a little.
You feel pain or tightness? Just a tightness.
Probably
Because
tightness.
you still have a scar tissue.
Yeah, it's
So-
not the pain that I was feeling before.
It's just you feel like a little bit tightness. It's normal to feel that. I expect you're gonna feel it until we totally break your scar tissue. You still have some scar tissue. We did not. Some patient in one treatment should be enough to break the scar tissue, but other patients just take a few treatment. Tightness is okay because we know still you have some scar tissue. As long as you don't feel pain and you feel you have full velocity or range of motion, that's fine. This is just the first treatment, so we're gonna work a little bit more on it. How you feel overall now? So you just did how many? You totally did
5 right now.
5, and how is that now? Give
I
me
feel-
feedback about shoulder and elbow now.
Shoulder feels. I mean, there's no pain after it. Yeah.
Mm-hmm.
And then the elbow doesn't feel like it's throbbing
Mm-hmm.
after I've thrown.
Okay.
It just feels, they both just feel like you said tight.
Just diet.
Yeah.
We're gonna work on it. So you had physical therapy before. So can you tell the difference between what you had before and ASTR treatment?
I feel like that scar tissue that you mentioned with physical therapy, it's usually I was massaged hands on or with fingers on the elbow and on the shoulder,
Mm-hmm.
and then with the products you just used on me, you literally feel the scar tissue going away as you grind on it, and
You feel
and
it's loosening
and
up, yeah?
and it takes a lot less effort and time.
Mhm.
Like with the massage therapy, I mean, these are like 30 maybe 20-minute sessions, you know.
Oh my goodness.
Yeah.
I feel bad for them. That's actually painful for them too. Okay.
Yeah. I mean, and those sessions, I mean, those, when it came to the shoulder, those massage sessions, they didn't, like, I'd feel good for the time being, and then I'd go back to being in pain. Yeah.
So it was temporary.
Temporary, yeah, definitely it was temporary.
Yeah. All right, awesome. I'm glad you're feeling better.
Yeah, thank you.
Yeah, thank you. Okay, Vincent, tell me, how do you feel? Today is your second visit, and we did some work on your shoulder, and you had already physical therapy before for your shoulder. So can you give me an update? How's everything now?
So after my first treatment, I had significant strength that I didn't have for the past 5-6 months since January.
And we did not do strength training. We just
we
did
didn't do any
release.
strength training at all.
Yep. Okay.
Yeah, and I've tried doing strength training on my own. Never didn't. It didn't help until we did the treatment, and the range of motion is better. I get like less clicking. I have significant strength. After the first one, I was like 90, and I went a week. It's been 2 weeks since the last time I've seen you.
Yeah. So the first treatment was 2 weeks ago.
2 weeks ago.
Now the second treatment in 2 weeks.
Yeah. So I maintained that strength from that. And then I had like maybe 90% strength. Now I feel like close to 100. Like this feels great. Yeah.
That's awesome. And I went over your throwing format because we had to change some your body mechanics. So I want you to actually do the throwing, and after you do it, tell me how you feel. Do you feel pain, soreness, and what the difference from the feedback I gave you to really work on changing the way you throw. Okay?
Yeah.
Okay. So we'll throw. We'll do 5 total, okay? We've been doing like today, actually, this is almost like the 50 throwing today, but we just record 5 here, okay? Alright, so feedback before and after the treatment, the way you throw and everything.
So before, when I throw, it felt like my arm was just slow, and it almost couldn't keep up with with the movements that I was trying to do. And now, I mean, now it's just obvious. It's just it's freer. Freer. The arm speed is much faster. Yeah.
Any pain, soreness, anything?
Yeah, no pain. Before I was feeling pain
immediately
in the back of the shoulder, and now it's nothing. Yeah, and
what,
full force.
What about your body mechanics? I can see totally huge difference if you watch the original video and now, like body mechanics. Can you give me?
My posture, walking and throwing, and just sitting, standing. My shoulders were, I don't even want to do it, but
yeah,
but
you look much better.
Yeah, like me thinking I was normal, really my scapula is all tilted forward and everything, and my shoulders, everything, and now, with like some simple cues, it feels different. It feels a lot freer. My shoulders feel freer to move and everything, and it's becoming a lot more natural.
Beautiful.
Just one day.
Yeah. So you had physical therapy before. How long did you had the physical therapy for? Shoulder, elbow?
Probably like 3 or 4 months on the shoulder, working like a lot of massages.
How many sessions a week?
1, but every week.
Every week for 3-4 months. Okay.
Yeah.
You had 2 ASTR treatment. What's the difference?
I mean, it was a much bigger difference, and it seemed like a lot less effort.
Yeah.
Yeah.
Short period of time.
Yeah.
All right. Awesome. Thank you so much.
Thank you.
Thank you. You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.